possible into resolving this situation and trying to get round the table and having a talk with the junior doctors?
Well, a huge amount of effort is going in to mitigate the impact of the strikes, to ensure that emergency cover is there. The clear message to the public is for those who need the NHS will be there in terms of responding to urgent calls, but to be mindful of the demands that they place on the NHS. But a huge amount of effort has gone into the contingency planning, the measures in place given the effects of the strikes, but clearly they've been timed to have an impact on patients, and I think that's very regrettable. Well, the government has shown that it is willing to listen and to engage in meaningful and constructive talks. We had those talks with other health unions, with the Agenda for Change staff. We have a recommendation from the NHS Staff Council to their members based on those meaningful and constructive discussions that we had. We also listened to doctors in terms of pension changes, and the Chancellor announced those pension changes at the budget. So the government has engaged constructively. My door is open and we remain willing to engage constructively with the junior doctors, but clearly a demand of 35%, which would involve some junior doctors receiving over £20,000 more in terms of their basic pay, is not reasonable to your viewers, to those who have to balance the wider issues of the economy and getting inflation down, alongside recognising the very real pressures that the NHS and junior doctors have been under, not least from the pandemic.